This week, I'm going to get real. It's already been explicitly stated that Paddy is a trans man, and this is justified by the existence of gender nonconforming people that have existed all throughout human history. Regardless of the stigma attached, largely by religious colonialism, this is known in mythologies across Europe from Bay Manere to Loki and more. Human mythology is largely based on what we experienced in those times, even if we couldn't explain it. Using mythology to fill in the blanks of human understanding is called a god of the gaps. This is a theological concept that emerged sometime in the 19th century. Basically, the idea is that gaps in scientific understanding are regarded as indications of the existence of God or gods. As scientific knowledge expands, these gaps tend to shrink, and what we once explained as deities with masculine and feminine bodies, such as Aphrodite, or divine curses such as Tiresias, evolves into what we would now describe in the modern day as transgender or transsexual. Now, it should be noted that widely transsexual is an outdated and sometimes offensive term. It's usually used by people who believe the correct way to be transgender is through medical intervention, what we call transmedical. This is controversial even within the trans community because in the current world, with medical care being what it is, and many transgender procedures being viewed as cosmetic, there are many places where these medical interventions are either not available at all or incredibly expensive. Furthermore, some people may not be able to use medical transition for a variety of reasons. Social stigma, such as being in a place that's hostile to transgender people, or pressure from a family or religious community. Some people might have adverse reactions to HRT medication, that's hormone replacement therapy. Generally speaking, trans women take estrogen either in pill form or in subcutaneous injections, while trans men use testosterone injections or topical testosterone gels and lotions. A common myth that I'll tear down now is that many people think trans men use testosterone in the same way some athletes use steroids in an attempt to boost athletic performance. This is either a misunderstanding of the difference between masculinizing HRT and anabolic steroids, or deliberate medical misinformation spread by people who don't want transgender people to be able to access this medication. It's important to remember that the difference is cypionate or enethanate is administered in carefully prescribed amounts at regular intervals in order to bring a trans man's testosterone levels into the normal levels of a man. Whereas anabolic steroids often use high dosage of testosterone, sometimes combined with other compounds. But hold it. The misuse of anabolic steroids, often for performance enhancement or rapid muscle growth, frequently involves taking testosterone at the levels well above physiological needs, which can pose several risks, including cardiovascular issues, liver strain, and severe endocrine disruption. This information is for general knowledge and should not be taken as medical advice. You should always consult with a healthcare provider any treatment decisions. In this case, likely an endocrinologist. Another common myth about trans men is that they are confused women or manipulated into being trans, that these poor, misguided souls are being duped and led astray. Not only is this sort of thinking incredibly false, it's also hugely misogynistic. It never fails to amaze me that so-called feminists that are against transgender people often claim that people who they see as women are naive, childish, easily manipulated, and so on. This type of ideology is predicated on the belief that women are inherently weaker, easier to manipulate, or victimized. In truth, trans men are men who take charge of their masculinity with a fervor that cis men could only dare to emulate. Trans men are truly self-made men who approach the idea of manhood with zeal and confidence. Rarely will you ever see a trans man claim himself to be an alpha because he doesn't need to posture to other men to prove who he is. This kind of confidence and self-actualization is a threat to bigots who seek to tear it down because they can't measure up. Don't believe the lies. Some people, even trans women, believe that trans men somehow gain male privilege when they transition. While a trans man may be given certain considerations, usually exclusive to cisgender men, on occasion, this should not be taken as any kind of proof that they receive the same level of systemic advantage as cis men for one very important reason. Any advantages they might receive vanish instantly once people around them realize or discover that they are trans. In the trans community, this is known as passing privilege, in which trans people who look convincingly cisgender are immediately recognized for their gender identity and treated accordingly. But passing privilege is fleeting and requires for a trans person to exist in stealth mode, hiding their transgender status from the world in order to escape prejudice. For many transgender people, they have already lived an entire life in the closet. They masked being trans behind a facade of attempting to perform the gender that aligns with their assigned sex at birth. For trans men, he might convince you he's just a tomboy, or many find comfort in the lesbian community while acting as a butch, masculine lesbian, or stud. Some butches or studs even use he/him pronouns, so in this way, trans men often find some semblance of gender affirmation in this way. But that only really works for trans men who are straight. Gay trans men are still attracted to other men. They might maintain romantic relationships with other trans men or with cisgender gay or bisexual men. Remember, gender identity is distinct from sexual orientation. Now, the hard-hitting thing. Dysphoria. What's it all mean? Gender dysphoria is a severe psychological distress caused by a significant mismatch between a person's gender identity and their assigned sex at birth, according to Mayo Clinic. It is recognized clinically when these feelings are persistent for at least 6 months and cause intense discomfort, anxiety, or disruption in daily life. People experiencing gender dysphoria may exhibit a strong desire to be rid of their current sex characteristics and instead possess the traits of their true gender. Common experiences include wanting to be treated or socially accepted as a gender other than one's assigned sex at birth, intense discomfort with one's own genitalia, breasts, or other sex characteristics such as facial hair, a strong conviction that one has the feelings or reactions typical of a different gender, or seeking out gender-affirming behaviors such as a change in dress, hairstyles, or adopting a new name and pronouns. In the medical community, gender dysphoria is defined by the American Psychiatric Association through the DSM-5. It is important to note that simply being transgender or having a non-conforming gender expression is not considered a mental disorder. The diagnosis exists specifically to describe the clinical distress caused by the mismatch and is often required for individuals to receive insurance coverage for medical treatment according to psychiatry.org. An important note is that gender dysphoria is not widely required to be transgender, and some trans people may experience gender dysphoria differently than others. A trans man may never want bottom surgery, known as phalloplasty, but he may want a mastectomy, or a trans woman may have no problem with her penis and yet may want to dress femininely, take hormones, or simply grow out her hair. Instead, what is generally sought is a type of gender euphoria. Gender euphoria is a deep sense of joy, confidence, and comfort that occurs when your gender expression and physical traits align with your authentic gender identity. Understanding gender euphoria is important because it shifts the focus from the negative outlook of distress to a more positive outlook of self-actualization and empowerment. Gender euphoria often manifests as an overwhelming feel of rightness. Many people describe it as a sudden wave of relief, feeling completely at home in their own body or experiencing a quiet, profound sense of normalcy. It is considered a celebration of feeling comfortable in one's own skin. For trans, non-binary, and gender-diverse people, centering experiences of euphoria is increasingly recognized as a vital part of mental health and resilience, actively pursuing spaces, relationships, and presentation styles that bring joy. People can build confidence and improve their overall well-being. And the change isn't insignificant. Due to psychological distress and social stigma and isolation, transgender people have a high likelihood to exhibit dangerous, self-harming behaviors and thoughts. This might look like taking unnecessary risks, showing little care for the future, deliberate harm to oneself, thoughts of ending it all, and other disturbing and dangerous things. Studies indicate that having a supportive surrounding that affirms a person's gender identity can reduce the likelihood of harmful ideations and actions by as much as 70%. and gender-affirming medical procedures have a success rate of over 97%. In any other medical community, this would be lauded as a miracle cure. Another prominent myth that I want to clear up in this video is the difference between gender dysphoria and body dysmorphia, formerly called body dysmorphic disorder, or BDD. The terms sound similar, but they're strikingly different when understanding what the cause is and how they're treated. Dysphoria is a deep disconnect or incongruence with how you identify internally and your external physical reality. Your view of your body isn't distorted, you still see your anatomy exactly as it is, but the anatomy itself causes psychological pain or distress because it doesn't match your internal identity. For dysmorphia, it's an obsessive preoccupation with perceived defects or flaws in physical appearance. In this, your view is distorted. You may focus on specific features like your nose, skin, or weight, and perceive it as hideous or abnormal, even though others see it as completely normal and unnoticeable, Rose. The difference also lies in the treatment. With dysphoria, the goal of treatment is to bring your body, life, and social presentation into alignment with your internal identity, and this is typically accomplished through therapy, social transition like new hairstyle, clothes, and pronouns, hormone therapy, or gender-affirming surgery. With dysmorphia, by contrast, the goal becomes to relieve the obsessive thoughts that cause the distorted self-image. This is typically done through cognitive behavioral therapy and sometimes medication. The two can overlap. For instance, someone with gender dysphoria may develop dysmorphia regarding specific features like breast size, muscle tone, or body hair. However, clinically and psychologically, they are recognized as two entirely different conditions with two completely different treatment styles, and trying to treat dysmorphia the same way we treat dysphoria, or dysphoria like dysmorphia, will result in equally similarly bad outcomes for both. The disconnect for those who don't understand these conditions is that they tend to conflate the two without taking the time to learn the difference. If there's anything this video accomplishes today, I hope that was it. So why do so few transgender people not get the care they deserve? Social stigma and gatekeeping, trouble with insurance, lack of availability of medical professionals who understand transgender needs, and political opposition, including legislative efforts to restrict or completely ban transgender healthcare even from transgender adults. Because of this, in many places, the care that trans people can get is limited, and in some cases, even something as small as having a supportive social web may seem like a pipe dream. And that's why we wanted to offer Paddy as a story of hope. Paddy lives in the 1300s in the Scottish Lowlands. Alden's culture is one of radical acceptance and diversity that would have been extreme for this time. However, the existence of historical myths outside of Christian purview seem to suggest that gender-diverse individuals not only existed in many cultures, but were accepted and even cherished as gods, magical beings, artists, caretakers of the young, and more. Given that, it doesn't feel right for the story of Paddy to experience any external transphobia. Everything he experiences is internal, self-inflicted. He doesn't understand the anxiety he always feels, the way his hands shake when he thinks about marrying Blair, the insistence that he isn't normal, that people won't understand because no one else in Alden thinks the way he does. So he thinks. Remember, Alden is still quite new. Blair and Paddy are some of the first children born to the village. So many of the relationships there are still within their own lifetimes. So it isn't that Ashley doesn't respect Paddy as a man, he honestly doesn't know, because no one talks to him about it like that. So when he sees Paddy and Blair together, his ignorance tells him that's two women. But there's still room that he could change his mind. If that would even change anything now, but who knows? Still, those thoughts strike like iron in a burning coal, and the glare of the blaze reflecting in eyes that gaze through it. Not there, deep in his thoughts. Paddy is angry at himself. Even if he is a man, he feels like a failed one. For failing Blair. How dare can he call himself that? What right and dignity does he possess for not meeting the basic standard of protecting and caring for his woman that he would hold himself to? Blair was the only one who understood. The only one who knew. A secret that he keeps from even Tam. From his father, who refused to see either of his children as anything more than his cherished princesses. His mother, who thinks it's more dignified for a woman to have long hair, and so Imel and Paddy both keep it so. But Paddy can't stand it. It's always getting in the way, just like his chest, sensitive and bothersome. He wears linen wrap to keep it flatter in the front, and this pushes it to make him feel broader side to side, but it isn't enough. In every reflection, he sees Tam's wife, Olivia and Patrick's daughter, Imel's sister. Only when he thinks of Blair does he see Blair's man. And you know, sometimes accidents happen in the forge. Things fall into the fire and need to be cut away. Shame that it took so long to grow out too, didn't it? Oh well. Thank you everyone for your continued support, and I look forward to giving you even more in the future. Our community keeps expanding with authentic viewers and subscribers that tune in every week excited for the next installment. Whether that's listening to my world-building rants or tuning in for a full episode, you're the ones that keep this channel afloat against an unforgiving algorithm that keeps trying to douse the flame. That's the meaning of many a mickle max a muckle. Many smaller things making a big thing. And now, a shout out to our patrons and channel members.
Plebe 64 Potato,
Mr. Lobo King 8778,
P64P,
Regios001,
Jack Plays K Plays,
Maria Elsa 6363,
Moose Now,
El Dragon Biano 3742,
Jack McLeod,
Persephoroth,
Josh is Mary,
Runaway Train 2502,
EA Shadow Gamer,
Sigma LaFlare,
Crochet Whimsy 413,
Anubian the 1335,
Angels Art and Gaming,
Aisha Kashif,
Pluve 81,
Aegis Knight,
7-Star Sanctuary,
and Chained Furry,
Emily Masternardi,
Heinrich 28,
Shadow Fox,
Arya Gamari,
Charles Tam,
Jace Moreland,
Pammy Poo,
and Lunder Lumen.